This is EKG number 75 of a 1-year-old male with a heart murmur. Right away we can see that the patient has tachycardia with a rate of approximately 150 beats per minute. We also notice evidence of a right bundle branch block indicated by the RSR prime pattern in V1 and V2. Looking at 1, 2, and AVL, we see that 1 is deflected upwards, 2 is deflected downwards, and AVL is deflected upwards, indicating a left axis deviation. Additionally, we also see a reversal of the polarization pattern in leads 3 and AVF compared to the other leads, and this is called electrical alternance. Knowing the patient's history of a heart murmur and the fact that he is a very young child, and the left axis deviation in addition to the right bundle branch block, we know that this patient most likely has an atrial septal defect.